Hello to the IEOM Society. My name is Professor Wiljeana Glover, and I am the Kletjian Distinguished Professor for Global Healthcare Entrepreneurship and the Faculty Director of the Healy Center for Global Healthcare Entrepreneurship at Babson College. I'm also Associate Professor of Operations and Innovation Management at Babson. And I'm excited to share with you today a little bit of my work on ethics and equity-centered perspectives of engineering systems design, themes, and application to systems of health. This talk is based on work that I've recently published with my colleague Rachel Hendricks-Stirrup in the Handbook of Engineering Systems Design. Both Rachel and I are health equity scholars and healthcare innovation and entrepreneurship scholars. And we often think about health systems design from the perspective of health equity. And so we thought that it would be helpful to see the aspects from engineering systems design that might apply to health systems design. And so I'll share just a little bit about this piece with you today. First, I'm going to start off with the context of engineering systems and socio-technical systems. I'll talk about the major ethical considerations that we notice in the engineering systems design literature. Then I'll talk about the importance of thinking about ethics as a multi-level model so that we can observe ethical behaviors and practices, not only at the individual level, but also at the meso and macro levels. And then I'll present 5 themes that were present in the current engineering systems design literature that we believe also apply to health systems. And I'll talk about how we see them applying to health systems. So first, engineering systems and engineering systems design is a really interesting space, as we all know, in part because of this kind of shared language between kind of the engineering systems literature, the socio-technical systems literature, and the enterprise systems literature. And we definitely felt in order to do the study justice that we wanted to look across all 3 to see how ethics was being discussed across all 3. We define engineering systems as large-scale, complex, and intricate with elaborate processes, and they include the technical, social, managerial, and institutional considerations and infrastructure. So some examples include water, energy, transportation, communications, etc. Very closely related are large-scale socio-technical systems. Perhaps one slight difference between the way that they're discussed in the literature is socio-technical systems tends to more strongly focus on the intertwining or relational coordination, if you will, between the social and technological elements. And enterprise systems comes more out of the information systems literature, but is also helpful in this space because of the consideration of processes, people, information, and knowledge content of the system. So as we wanted to examine ethical and equity-centric perspectives in the engineering systems design literature, we wanted to consider all 3. And across these bodies of knowledge, we noticed 6 major ethical considerations. First, distributive justice. Distributive justice is one of the most commonly addressed ethical considerations across the literature. And in this space, designers aim to assess and observe the distribution of benefits and then minimizing costs across an engineering system. So one paper that comes to mind from colleagues that were doing work in South Africa to think about where toll booths were located and how the cost would impact truckers, so major corporations, compared to individuals in the country. Procedural justice examines the considerations of the public's values during design and participation in the design process. We believe that procedural justice may be one of the most important ethical considerations from the engineering systems design literature that would apply to the health systems design literature, in part because of the importance of getting the public, the individual, the patient's feedback and thoughts and ideas and opinions and design concepts into health systems design. Safety is perhaps one of the ethical considerations that's closely shared between engineering systems design and healthcare, and is something that is already somewhat central to the discussion of health systems design. Privacy, trust, and autonomy are increasingly major ethical considerations, in part because of the rise of research in artificial intelligence, augmented reality, and virtual reality. As those become more ubiquitous in engineering systems design, we have more conversations about ownership of data, privacy of data and individuals, building trust with individuals, and the autonomy of individuals within these platform systems that we're creating. And finally, sustainability is important in any major systems design. As we develop either engineering systems or health systems, we aim to create them in such a way that would not have a detriment to future generations. And so those are the six ethical considerations that came to the fore in the engineering systems design literature that we wanted to bring forward to consider how they might impact health systems design. The next kind of concept that I wanted to present to you is the importance of thinking about ethics and equitable design as a multi-level model. So we found across both the engineering systems design and the health systems design that literature that there was some precedent for considering ethics as a multi-level model. In the engineering systems design literature, there were standing scholars that have considered ethics at a micro, meso, and macro level. And we find that that framing is very helpful and can be very helpful for the health systems design literature so that the discussion of ethics and equity does not remain kind of at the individual level, but that it can permeate the organization and the broader enterprise and industry level as well. For microethics, they're typically defined as the individual engineer and internal relations of the profession. Mesoethics are at the organizational level, so it includes organizational approvals and cooperation and social interactions and acceptance or resistance of fellow systems developers. And macroethics includes the collective social responsibility of the engineering profession and the legal, regulatory, and policy issues involving technology. We find these same levels at the in health systems design. So microethics is perhaps the most heavily discussed in the health systems design literature, where there's a great tradition of discussing beneficence, non-malfeasance, justice, and respect for autonomy. There are also, work that's been done on at the meso level. So for organizations to think about professional ethical principles and codes to which professionals are expected to endorse and adhere to as they engage amongst themselves as peers. So what we might think about is, IEEE standards for ethical principles. In the engineering world, we would think about the American Medical Association or similar associations in countries for health systems. And then finally, we really feel as though macro ethics is really a space for great opportunity and growth in health systems design. We define it as a moral code that would guide the design of a network of people, institutions, and resources that provide the services and perform functions that impact social determinants of health for a targeted community or region. And this is a space where, again, as we're kind of leading into these themes, we really find there to be great opportunity to have discussions across borders, geographic borders, in terms of how we think about designing these systems and what moral code should exist kind of at the country or societal level. So now I'm going to go into our 5 themes that, again, were the most prevalent themes in the engineering systems design literature and in the lit review that we conducted. And then I'll talk about how those applied or how we believe they might apply to health systems design. So the first theme was the importance of integrating ethics and equity centered perspectives into design. And this is work that has really been guided for decades by scholars of VSD and other approaches to kind of value-based design. And it really emphasizes the shift from ethical awareness of the individual engineer or provider to systems level ethical awareness. Earlier stages of user inclusion are also, they appear here, and it's something that we think might be the most important aspect of how engineering systems design might influence health systems design. One article that came to mind was a study of wind turbines and the discussion of not just thinking about the ethical awareness of the individual engineers that were working on that particular project, but the work that was done to involve the community and to make sure that systems level ethical awareness was taken into consideration as the wind turbines were being designed and installed. And so we think that that perspective could really, and that involvement of earlier stage user inclusion, specifically from more diverse patient groups and patient caregiver groups, could be implemented to increase the ethical consideration during early stages for the design of health systems. The second theme that we noticed is the recognition of system boundaries and to have broader discussions about what can be controlled or cannot be controlled. So for example, in the engineering systems design literature, there has been discussion of the kind of the nexus of influence that engineering systems design teams would have, and the parts of the system that may not necessarily be controlled by those engineers, but still deserve consideration in the design process. And kind of echoing in part theme one, the importance of bringing more stakeholders to the table when necessary in order to best mitigate some of those boundaries and to understand how the new design might influence the broader system at hand. And so engineering systems boundaries influence the inclusion of non-technical elements, so be they social, political, economic, and institutional, and those have ethical implications. The role of system boundaries it shifts our focus from what can and cannot be controlled to what and who can be positively informed. So while, for example, going back to the wind turbine example, while I may not be able to necessarily control a neighboring business or community, I can at the least positively inform and have them as a part of the discussion. And so we see a possibility of kind of broadening our conceptualization of system boundaries by including and considering historically disenfranchised populations as we develop new health systems, populations or groups at highest risk of misdiagnosis, and individuals or groups seeking to protect or uphold their personal or health information privacy. Next, we found a theme of the importance of developing augmented systems design criteria. And this really drives us to metrics, right? So as we think about the importance of procedural justice, safety, privacy, trust, right? All of the factors that we talked about before, it opens up an opportunity to think about how do we apply measurable systems design specifications? What does that look like? There are some that are existing and are well discussed in the engineering systems literature, such as specifications on access, cost sharing, risk distribution, safety, and there are some of those that are present in the health systems literature, but not to as great of an extent. And so we think that this is a great opportunity because in part, they are grounded in some of the traditional ethical tenets of medicine already. And so there could be kind of great opportunity to consider some of these specifications in the health systems design literature as well. Theme four was in part a area where we thought it probably deserves kind of its own paper, but the importance of managing trade-offs and value conflict in design. And so we found there to be great discussion. And again, it connects to including multiple stakeholders, what are the boundaries? And as we consider those things, tensions emerge, right? So we have a tendency to think in terms of dichotomous reasoning, typically, when we have multiple considerations, right, in a system. And so instead of considering it that way, there's been great kind of movement in the engineering systems design literature of practicing procedural justice. So, for example, leveraging community goodwill as a focus for value sensitive design and including the community members early, as we talked about before. But that practice can actually help to mitigate dichotomous reasoning or feeling as though it's an either or as we're designing for new systems. We also find differences in ethical behaviors, choices, and concerns among key system stakeholders for various legitimate reasons, right? So different system stakeholders may value privacy or safety or procedural justice in different ways. And so again, this is a place where we find the potential and opportunity of using values sensitive design based approaches and kind of marrying them with some of the work that's happening in the patient-centered care movement as a way to mitigate the tension or these trade-offs. Finally, and perhaps the most challenging, is that when we're talking about any systems design typically, right, even for engineering systems where there's a little bit more flexibility to create something new, we're still dealing with legacy systems, right? And that's particularly true in health systems. It would be very, very rare, even if I created a new system that is being created within the context of existing health systems, within existing health policy, et cetera. And so here we find it important, and as we kind of manage that trade-off of, dealing and managing the old and bringing in the new, that we revisit legacy values that serve as the foundation for how such changes are made. And so this becomes an opportunity to kind of observe those legacy values, those legacy policies, and consider if we really want to create this new systems design that we find necessary, how do we uh, kind of change the foundational policies in order to make that happen. So one very simple example, we've been all through COVID-19, there are some changes in health systems design in terms of how we handle telehealth and telemedicine. And there is work that is being done to really make that a permanent, a mainstay in the way that care is delivered in the United States. And there have been some movement around making sure that the policies that kind of undergird or that are foundational and that represent our legacy system, that they will support some of the new telemedicine systems that are emerging. We also find, and I think of the work of Abner Mason here, that we also need to think about the connectivity of those that may be disenfranchised, that might not have the same, communications capabilities, and where those disparities lie, and that those then become legacy systems that also need to be addressed if we are moving as, telemedicine being kind of the primary way that people receive their care. Last but not least, theme 5 was the importance of educating current and future engineering systems designers and ethicists in health. So we found in the engineering systems design literature that there was a call for an interdisciplinary view to consider more kind of macro ethical frameworks. And we also found that in the health literature as well, that we need a more interdisciplinary view, and how are we training the next generation of systems designers in health to think about micro, meso, and macro ethical considerations as they're designing. And so one of the major takeaways from this section was the importance of cases that examine everyday experiences so that we no longer think about ethics as from kind of sentinel cases, but rather how do we think about ethics day to day. And so some suggestions are to think about and build in design thinking within our process analysis and operations management and industrial engineering courses, including more health equity content into systems design courses, might be some ways that we can start thinking about more everyday ethical experiences as we think about systems design in general and health systems design in particular. Thank you all so much, and feel free to reach out to me at wjglover@babson.edu or at Wiljeana Glover on Twitter, and I look forward to connecting to you all more. Thank you to the IEOM Society for considering my work.